Flying home after the holidays. Getting vaccinated or boosted is the first step towards safe travel, expert says. Health experts argue air travelers to take precautions to avoid Omicron. CNN. For Americans traveling after Christmas and New Year's, getting their COVID 19 vaccinations or booster doses as soon as possible is critical to safely avoid serious illness, one health expert told CNN Saturday. Amid a surge of cases nationwide fueled by the Omicron coronavirus variant before the holiday season, parts of the country are reporting increased hospitalizations and deaths, and people need to be prepared for the heightened risk of infection during travel by taking preventative measures, according to Dr. Peter Hotez, Dean of the School of the Tropical Medicine at Baylor College of Medicine. If you only gotten 2 doses of the Pfizer or Moderna vaccine, even though that officially counts as fully vaccinated, we know that each infected on breakthrough symptomatic illness is close to zero, Hotez told CNN's Amara Walker Saturday. The initial 2-dose regimen will still protect better for serious illness, he said, but you still need to get boosted. I think if you want to travel safely, booster shots may take 2 weeks to provide peak immunity, doctors have said, meaning the sooner one gets vaccinated, the better. Other steps, including wearing a quality mask, can help the lower risk of infection. Millions of Americans who are immunocompromised should delay future travel plans for a few weeks, if possible, in the hope that the current surge won't span as long as the previous ones, Hotez said. And due to the infectiousness of Omicron, even if you are boosted, you have to face the possibility that you get symptomatic breakthrough illness going through airports and going on Ubers, he said. The US has fully vaccinated nearly 62% of its total population, leaving millions unvaccinated at higher risk for serious illness and death from COVID-19, according to the data from the US Centers for Disease Control and Prevention. And more than 31% of those inoculated have received additional doses or boosters. Even though early research indicates that Omicron may cause less severe illness than the Delta variant, the recently detected strain is highly contagious and threatened to strain healthcare resources, officials and experts have warned. And the hallmark of the season has been the shortage of COVID-19 testing kits, a crucial tool in attempting to assuage the fast-moving virus. Dr. Jeremy Faust, an emergency physician at Brigham and Women's Hospital in Boston, said while there is always a risk to contract the virus while traveling, there are mitigation efforts available. So if someone have been exposed in your orbit or in your circle or have been infected, you don't have to assume everybody has it. Do continue to do things like wearing masks around people or testing, Faust told CNN's Boris Sanchez Saturday. And for those traveling, Faust advised to look for the weak links in the chain. It's not necessarily on the actual airline itself. It might be the airport line in the bathroom where you need to be extra careful with mask and other mitigation measures, he said. And I think depending on your threshold, you have to adjust accordingly. Treatment options narrow for Omicron. With millions traveling, Omicron was also partially responsible for the Christmas weekend cancellations of about 1,700 flights within, into or out of the US, according to aviation tracking website FlightAware. Airlines, including Delta and United, have said they are experiencing staffing shortage due to Omicron, which became the dominant strain in the US last week as officials announced a new wave of measures to combat the spread. And as for fighting Omicron, currently there is one monoclonal antibody treatment that is still expected to be effective against the strain. The US Food and Drug Administration said Thursday in a statement. It's unlikely that the treatment known as Regan-Cov or the combined use of bamlanivimab and etesevimab will retain activity against the Omicron, according to the statement. That means sotrobimab is the sole monoclonal antibody treatment currently available to fight the Omicron variant. The Office of the Assistant Secretary for Preparedness and Response has moved to halt allocations of the other monoclonal antibody therapies and that 300,000 additional doses of sotrobimab will be available in January, the agency said. The US is also experiencing a shortage of the monoclonal antibody treatment Evusheld, which will only be given to people who have compromised immune systems and do not have active COVID-19 infections. Federal officials purchased up to 700,000 doses of the preventative drug, enough to help only 1/10 of the estimated 7 million people who were eligible. The COVID-19 vaccine is administered at the pop-up clinic in the international arrivals section of Los Angeles International Airport on Los Angeles, California on December 22, 2021. Minorities are still at higher risk for COVID-19's most severe outcomes. From the onset of the coronavirus pandemic, racial and ethnic minority communities have been bearing the brunt of COVID-19, whether through illness, death, or economic struggles. Nearly 2 years on, some of those disparities remain. Racial and ethnic minority groups who had other health conditions and contracts COVID-19 were more likely to have a higher in-hospital mortality rate than white patients, according to a study published Thursday in JAMA Health Forum. The study, which tracked the data from more than 40 million hospitalizations in Medicare beneficiaries between January 2019 and February 2021, found a decline in non-COVID-19 related hospitalizations and an increase in COVID-19 related hospitalizations across the board. But the average rate of Black and Hispanic COVID-19 hospitalizations exceeded that of the white beneficiaries through February 2021, researchers wrote. Beneficiaries hospitalized with COVID-19 are more likely to be from racial and ethnic minority groups relative to hospitalized beneficiaries pre-pandemic, they also noted. The persistently widened disparity in non-COVID-19 non-COVID-19 mortality may be connected to factors including differences in access in COVID-19 testing, access to care, and changes in case mix and care quality related to pandemic factors. The authors wrote, for COVID-19 hospitalizations, mortality was not significantly different for black patients when compared to white patients, but mortality rose 3.5 percentage points in Hispanic patients. The researchers suggested that the spillover effect, which increased COVID-19 hospitalizations, may have shifted the distribution of hospital resources, potentially widening racial and ethnic disparities in outcomes. For non-COVID-19 related hospitalizations, mortality in black patients rose nearly 0.5 percentage points more than in white patients, a 70.5% increase over the pre-pandemic mortality rate among black inpatients. CNN's Virginia Langmead and Elizabeth Cohen contributed to this report.